Providence, and I'd like to start first by welcoming on Representative Patricia Serpa, the chair of the House Oversight Committee. No shortage of things to talk about today, so I appreciate your coming in today, Representative Serpa.
Thank you for inviting me.
Lots to talk about, and I really kind of wanted to start with UHIP. Here we are, middle of April, just learned about the feds investigating what's been taking place here in Rhode Island. What do you know about that?
I know what you know. I read what you read in the media, and we've been having a very difficult time. It's been a challenge getting information. It's probably you and some of the viewers who might watch Capitol TV, and I'm surprised at the numbers of people who do. We have a hard time getting a lot of information from the administration. Sometimes we have to ask once, sometimes we have to ask twice. Eventually we get what we need. Originally, when we began these hearings in October, we were suspect of the accuracy of the information, and now I guess the federal government entertains the same suspicions because they're asking for a boatload of documents, literally a boatload of documents, and I imagine it's going to take the administration weeks and weeks and weeks to comply. I don't know how they're going to make the April 20-something deadline to comply with that request. It's massive.
Now again, this is the federal government looking at what's taking place here. Any overlap? Is there any role that oversight will play, or does this have to play out sort of in the auspices under the federal government?
I think there's plenty of overlap. In fact, I do know that one of the things the federal government is asking for is any results of any internal audits. And coincidentally, about 4 to 6 weeks ago, we asked our own Auditor General for the state of Rhode Island, Dennis Hoyle, to conduct an audit because, as we were saying, we were suspicious, we were suspect that maybe we weren't quite getting the dollars and the cents, the numbers, the facts. They weren't credible or entirely credible. So Dennis Hoyle is in a prospect of completing that now. We should have that in a couple of weeks, and wouldn't you know, that's one of the things that the feds are asking for, any results of any internal or external audit. So there's plenty of overlap.
And again, you were looking for these numbers, looking for the audit. I mean, we do know about the problems of implementation, and the Rhode Islanders directly impacted. How does this just pile on the issue of the day-to-day operations of making sure Rhode Islanders in need are getting what they need? Now tossing into the mix, we're talking about sort of big levels of bureaucracy. So from the lowest level, again, of trying to address the needs of Rhode Islanders up through the highest level, I mean, can you wrap your hands around this?
I couldn't wrap my head around it from the very beginning when the federal government said, don't do this. They clearly issued warnings. They were obviously more familiar with the inner workings of our systems than our own people were. And 27,000 people were left without services. We literally came in off the campaign trail because we knew right after this launched in September, we knew it was going to be a disaster. We came in from the campaign trail. We had a first hearing in October. We continued them November, December. We've had one every month. And it just boggles my mind that an old system that was working, while not perfect, it was working, it was getting services and food benefits to the people who needed them. They insisted to us that the old program could not be run concurrent with the new program, and I don't know a whole lot about rolling out programs, but I have worked in a little bit of business where you have a new program running, you keep the old one going, so that in case something is wrong, as was evidenced with this new software rollout. So now supposedly we're down to somewhere between 11 and 13,000 people still not getting the services and the food stamps they need. That's still not good.
And we keep seeing these numbers, you know, still continue to inch upwards, as we were told by the governor that could take upwards of a year to fix. What is being done? And you're in there, you're in the weeds. Apart from putting additional staff on it, what is the state doing to, again, get those numbers down? And is it being effective?
I do think that the acting director, Airp, is doing the best he can with what he was handed to work with. And frankly, it's an insurmountable task. If you have workers on the inside who are frustrated, and they go into that job knowing they're not going to get rich, they're not going to make a lot of money. They go into that job because they want to help people. People come in, they need adequate housing, they need some cash assistance, they need daycare. And you know, that's an interesting thing. I'd like to take 1 minute to explain. I don't think people understand that sometimes we want to keep individuals or families working, so we give them a small child care subsidy. So by paying for their child care, it keeps them from needing other state services, food stamps, cash assistance. So it's really a bang for the buck. So you have families who have lost their jobs because the child care workers, child care people were not getting paid, and obviously they have businesses to run, so they're not going to take children without getting paid for them. And I know I'm branching off here because it's just so fresh in my mind. We know that it's a cost-saving measure to keep people out of hospitals and for service providers to go into the home to deliver PT, OT, CNAs to give baths. We know of about 5 small businesses who have gone out of business, so there are a number of newly unemployed people because of those 5 businesses going under. There are people in their homes who can't get care because the other programs won't take them on because they're worried they won't get paid. So guess what could happen? They could end up back in the hospital, costing the taxpayers more money in terms of our premiums going up. So this is just a whole wraparound problem that, you know, it might be easy for those of us who don't receive those direct services to say, oh, thank God it's not them. Thank God it's not me, it's them. But it is us because we pay for these services.
Yes.
So it's just layer upon layer upon layer. As I said, there are so many layers to this onion. The more you peel it away, the more of a very bad smell it has.
And you talk about, you know, the folks who say, well, thank goodness that this doesn't affect me, but it's a third of Rhode Islanders, correct?
A third of Rhode Islanders receive services
this
of
isn't,
some sort.
Of some sort. This isn't a small segment of the population. This is a sizable segment that needs services. And again, the governor's talked about this, said this is going to take at least a year to get through. Do you have hopes that this is going to get fixed anytime soon?
Not before that year. So if you mean by any time soon, within 3 to 4 months, no, I don't. But I do believe her when she said it could take a year. The problems are so massive, inside and out, that I do believe it'll take a year, unfortunately.
And how have you found your role, again, as chair of oversight? Again, you're looking at an administrative function, but that's your role as the legislative body to do so. Do you feel like you're having an impact at all?
Well, I think if we had done nothing, there would never be this sense of semi-urgency that I sense on the part of the administration, because oversight is in a unique position. Because of separation of powers, we have, as legislators, cannot sit on the inside on boards and commissions, and we have no say. In an instance like this, maybe this is an example where it's not such a good thing. If someone had been on the inside and was able to oversee DHS in some capacity, we would have never let it get this far. So our role as oversight is to oversee governmental departments. Well, this one was such an emergency so early on, we began with DHS. And honestly, I had no expectation of beginning there. I had no intention of coming in off the campaign trail, but it was such a sense, as you say, of affecting a third of Rhode Islanders. I said to the speaker, this is not anything that we can put off till January. And he agreed, and he sensed. And my colleagues were wonderful in coming in from the campaign trail, and that's not an easy thing to do at the busiest time, just before an election. But we all shared the sense of service, and that's what we do for not a lot of money, but we know what we sign up for. And I think if we had not done it, I think there would have been more of a laissez-faire attitude. Oh, we'll get to it, we'll fix it. So by keeping the pedal to the metal, as we say, that's really all we can do. And people from the inside will call me or email me and say, fire this one, this one's responsible, fire that one. But because of separation of powers, the administration and the legislature have 2 entirely distinct roles, and I will keep the pressure on.
Speaking of keeping the pedal to the metal, a story that Go Local had done this week was, again, really looking at DCYF, the number of dead babies, 10 over the last 26 months, reports recently that there were 2 near deaths, so we're just hearings on that. Where's the sense of urgency in the state with regards to DCYF?
I sensed it in the committee that night. I sensed it on the part of the child advocate, who did a painfully honest report. But after the meeting was over, I intend to follow up, but honestly, I have to agree with you. I don't sense a sense of urgency. Dead babies are nothing to be taken lightly. And the thing that bothers me the most, that I think that at least some of them may have been avoided, because what we learned through that hearing and going through the budget, the DCYF budget, there were 40-some odd frontline worker positions funded in the budget.
At least 40, yes.
At least 40.
We saw upwards of 110 that were put in the budget. Again, you mentioned the frontline workers. Will there be continued pressure to fund these key positions
Absolutely.
coming out from this? Will we see continued pressure from the Assembly
Well,
on
I intend
this?
to have Dr. Tristan Noel, she's the new director of DCYF. I'm going to give her a month or 6 weeks to kind of get her feet wet. She promised us at the hearing last week that she would make that a priority, and I'm going to see to it that she does. We had someone from the administration, Mark Dingley, in place of Mr. DeBiase, and everybody knows how long it takes to get things done in government. But I very clearly said to Mark Dingley, please, don't let this take 2, 3, or 4 months for these new hires to get on the street. Once they are hired by the department, please get them on the payroll so that they can get the specific training they need and how to conduct an investigation and frankly all of the other awful things they have to do, and get them out there. We can't have any more dead babies. And you know, it just, like when I put all of this together in my mind, it just sends a message to me of how poorly we treat the poor, how lightly some people seem to dismiss them. If the people affected were another socioeconomic class of people, there's a part of me that thinks there would be more of an outrage, more of an uproar, but it's them. It's not me. And I don't say that in a meanness or an unkindness, but sometimes we treat our poor very differently than we treat some others.
Do you feel that you got a sufficient answer when you inquired, when the committees inquired about that lack of staffing? Now, I know that there had been some almost justification of saying, well, we saved money, we didn't have to do this. How did this get to this point that they thought it was okay not to fund these positions, not to fill these funded positions?
The acting director appears to me, and it appears to all of the committee, that her mission was to save money. There was money budgeted for, as you say, 100 and some odd positions, but her final report was a log of how many fewer placements there were out of state, how many children were taken out of placement and returned to the home, how many fewer referrals were made to this, that, or the other agency. And it's just inconsistent with everything else going on in our society. I was sitting there listening to it and I'm saying, well, how could there be fewer referrals, fewer out-of-state placements, fewer services when we've got a crushing drug epidemic in this state? And we all know the family and the social situations that accompany societal drug epidemics. So how can we have an increase in that and fewer needs in society? It's totally inconsistent.
Did you get a sense, maybe, I don't want to say window dressing, but to try to make it seem like things were better than they actually were?
Total window dressing, total of look at what a good job I did, when in fact it was nothing but creating a horror show, and it created a nightmare. And we're disgusted, frankly.
So we'll continue to see more, both UHIP, DCYF. What else have you got on your plate that you might want to make sure viewers are aware of taking place up at the State House?
You know what? I said to the committee, and I said to the House Speaker, that I think that the best way government operates is to never know who might be called before us next. I want them to get the message that if you get called before oversight, you better have your ducks in order, your books in order, your payroll in order, your staffing in order, because if it isn't, the public will know. And so I'm going to reserve that for right now. So
if you're watching here and you have the possibility of coming before the House Oversight Committee, Representative Serpa wants to keep you on your toes and make sure that you're operating in the best possible manner. I do want to hit you on 2 quick things before you take off here. Big statewide issues. Marijuana hearings. I know it's not the purview of oversight per se, but what's your take? You know, we heard this past week that there were some officials in the Raimondo administration who took issue with some of the points of this legislation and would like to review it further. Do you have a sense of if marijuana might go this year or not?
Personally, and I don't want to speak for everyone, but I disagree with what's been put out there, that there is overwhelming support for it amongst the members. I don't sense it.
Okay.
I mean, unless I have my head in the sand, I don't sense it. I know that Massachusetts and Maine have legalized it. I think that most of us kind of want to let them float the trial balloon and then see what happens. I mean, I'm not naive. It's coming. It's here. It's coming. Tax, sale, and regulate, it's coming.
Yes.
But Colorado's had a number of problems. Maine and Massachusetts are close by. I, for one, am happy to step back, let them figure out all the problems, and it might be a great litmus test for us to go forward.
We'll continue to keep an eye on that. It's been a big issue that folks have been talking about. Another issue folks have been talking about, the potential for a new Pawtucket Red Sox stadium in Pawtucket being vetted to go through the General Assembly. Unlike last time, when they had gone to Commerce and talked about incentives there, made it very clear that this is something that will have to be taken up by the General Assembly. Now, last time, a lot of opposition to what was put forth. This time around, looks like they're trying to get support from the Pawtucket Red Sox side of things. What are you hearing up at the State House?
Again, I've seen no plan, but from my own constituents in Kent County, I hear much resistance to it. They don't want any public money going towards a private stadium. That's what I hear in my district, and I'm not in the other 74, so I can only speak for myself.
No, it is an interesting question. I do ask politicians, again, who aren't in that direct Pawtucket area. Of course, in Pawtucket, it's a different ball game, so to speak. But when you're asking residents from around the state to, again, I guess, as you said, we're waiting to hear them make the case for why taxpayers should be able to do so. Do you think, as we stand here, middle of April, coming in, we're on recess this week from session, that it's sort of late in the game, that folks, here we are, again, kind of 2/3 through the session, if something gets put forth, do you think that there's an issue with timing with this?
I agree with you. It is late in the session, and I still think, like many of my colleagues, everybody suffers from 38 Studios hangover.
Yes.
No one wants to be rushed into making a critical, expensive decision. No one, not about any issue.
Anything.
Not about anything. We're all stepping back and wait, and we want to look at from the top, from the bottom, from the left, from the right, inside and out. So you're right. It's going to be almost the beginning of May by the time we get back. Finance has well over 100 bills to hear. In addition to the budget, the Speaker has committed to getting us out of there early to mid-June, so if they're going to make a proposal, I would expect that they have to make the proposal quickly.
Very, very shortly, so we'll be keeping an eye on that, but very appreciative of your coming in today.
It was fun.
Talk with folks. That's what we like to hear here. It's a
fun
conversation, really bring to viewers sort of what's going on everywhere around the state, around the country, around the world, but I appreciate your being able to come in today. Okay, Representative Serpa, thank you so much
for
today.
having me.
Have a safe trip back.
I will.
Okay,
Thank you
we'll
so
talk
much.
soon.
Bye-bye
Thank
now.
you. Representative Patricia Serpa, the chair of the House Oversight Committee, had her in today to talk about a number of very important issues facing the state right now. Clearly, what is going on with UHIP, and obviously heard that the feds are looking into it here. Now, that's just simply from a contractual and monetary standpoint. Also spoke about what's happening with the caseload, how that's being addressed, how the Oversight Committee will continue to play a role in that. And of course, talked with DCYF about DCYF, the story that Go Local did this week, again, asking where the outrage is for those 10 dead babies over the last 26 months, 2 near deaths. Patricia Serpa said that we'll continue to be pressing that issue closely, especially the issue of positions that were funded but not filled. Always interesting to be able to get Patricia Serpa's perspective. I do want to note one of the things that she said, though. I wanted to know what she had on her plate coming up. Said she wanted to keep folks on their toes, didn't want to forecast who might be called before oversight, because again, they want to make sure that folks are doing what they're supposed to be doing, keeping their books in order. So she kept that close to her vest, but we'll be keeping a close eye on the House Oversight Committee as